I think first and foremost it's improved access to patients. So certainly we had a lot of unattached or what we called orphan patients. That one's obvious, but in a practice itself, when I came on board, patients were often waiting weeks or even months to have an appointment with their family doctor, which obviously is not the best case. So once nurse practitioners start in the allied health, it certainly frees up more appointment time, and now patients can call and get an appointment that day. So that's probably the most important thing, and I expect that patient satisfaction has improved, and probably patient care from the perspective of being able to monitor chronic health problems more closely. I think another aspect is that it's improved the quality of life of the people who work within healthcare, which is going to impact the health of the community. You're going to attract more physicians, nurse practitioners, other allied health, and keep them because their quality of life is better. They're not stressed. They have time to spend with their patients and feel like they're doing a good job in impacting their lives. So it's going to have a dramatic effect on the overall health of the community.
Well, I think the first thing that would be noticeable is that we were able to take on about 600 more patients in the first year of the program, and this of course is because we had at the very beginning a nurse practitioner who was outstanding and took a lot of responsibility and was great with our patients. She allowed us to see more patients in a day, and I think it really enhanced the variety of patients that we were seeing, as far as we had a lot more exposures to our young patients, because our nurse practitioners seemed to have just a great knack with them. When we added on our social worker, our mental health worker, Stacy and Ann, and certainly with our dietitian, Kathy, and our pharmacists as well, we have seen a tremendous number of opportunities for patients who weren't able to see some of these experts in their field, and the overall quality of care from either the psychological or especially in things such as obesity and in diabetic care have been greatly enhanced. I think the other thing that has been very positive is that just from a personal enjoyment, I think that our staff are a team in the best way of the word. We support each other, we're there for each other, and I think it helps us to enjoy our work even that much more. I've never had as much fun practicing medicine in the last 3 years of being involved in a primary healthcare team. It's really allowed me to practice medicine in the way that I want to practice it.
Well, in a number of ways, actually. First of all, I think patients get a more variety of services, since we have many allied health professionals who add significantly to the breadth of service we can deliver, like dietitians, social workers, mental health workers, nurse practitioners. They all help us provide a wide range of service. Also, we can provide the service to more people because we have more help, we have more professionals who can see patients, and therefore we were able to roster a fairly large number of new patients to our practice, and that has reduced the problem of orphan patients who don't have a family doctor.
Family health teams?
Yes, well, prior to the introduction of the multidisciplinary family health team model, there were very few resources in the community for people that were affordable, for people and patients who required psychological help and emotional support for various circumstances that are occurring in their lives. Most people cannot afford to pay for a private practitioner. There was nowhere else for doctors to refer their patients to. Now, every family health team has a mental health clinician to whom the family doctors can refer their patients for support. This is an idea whose time has come. It's a huge support for doctors in terms of providing service for their patients, and it's also an opportunity and a service to patients that has not existed before.
A registered dietitian has a 4-year university degree as well as a 1-year post-grad medical internship, and then we are licensed as a medical professional. Well, I think with the explosion of information technology that it's really quite difficult to tell what is good and bad nutrition information out there. A lot of people put themselves out there as nutrition experts and nutritional professionals, and they try to make recommendations on supplements as well as weight loss diets and even diagnosing food intolerances. And your dietitian will actually help you sort through all of this. Because we work as part of the medical team, we work with the other allied health professionals and your physician, so we can have a direct contact and do direct referrals to the physician or the other allied health people. We promote disease, we integrate your health so that you can be proactive with your own health and learn to take care of yourself.
I joined the Peterborough Family Health Teams about 1.5 years ago, and at that point in time we didn't have any pharmacists involved in the team. So my role was to develop programs that would help with patient care in the community, and then also to recruit pharmacists to become part of our family health teams. So we're looking for programs that would enable us to do the things that pharmacists dream of, and that would be to make sure that all of our patients are on the correct medication, the correct dose of the medication, and that they understand what they need to about the medications, and that they're taking them in a way that works well into their lifestyle. So that was sort of the motivation behind all of the program development that we did. And so we looked at the strengths the various pharmacists in the community have, and we're blessed in Peterborough to have some amazing pharmacists with some different pockets of expertise. So one of the programs that we've put in place is our anticoagulation clinic, and the clinics are for people who are taking warfarin, Coumadin, or otherwise known as blood thinners. And we're able to offer a point-of-care testing service for these patients. So rather than going to a lab and then having the turnaround time and then having the physician call the patient with the results and recommend dosing over the telephone, we're able to see the patient in one-stop shopping, if you will. So the patients come in to see us, we do a finger prick to get the result, and then in there we're able to provide the result to establish the dosing that they'll be taking until their next visit and establish their next appointment. So all of that has been able to work toward great patient endpoints for us. The patients are really aware of what they're taking, the side effects of the medications, anything that might interact, and as well they've become more knowledgeable even about the results that they're looking, the numbers that they're looking for, and we've seen we've had really great feedback about in our clinics. It's been really exciting, and the other part of that is that we've been able to assist the physicians' offices in terms of taking that whole sort of pocket of looking after the monitoring of the anticoagulants out of the daily office routine. So it's freed up time there as well. So it's sort of been a double benefit. And the other thing is the pharmacists that are working in the clinics really love what they're doing, and we've become very attached to all of the patients. So it's been a great opportunity for all of us. We've set up a couple of other programs as well. One's a program with diabetes, and we have a number of certified diabetes educators in Peterborough who are playing a role in helping to manage the medications that persons with diabetes would be taking. And that program got off the ground just before Christmas time and has been very well received. And as well, we have pharmacists who are working with patients who have either recently been to see a cardiologist, a nephrologist for their kidneys, or have been recently discharged from hospital. And often at those three junctures, we see changes in medication, and sometimes it's not always clear for patients what they're to take and when they're to take it and how they're to take it. And so part of our program is to review all of those medications with the patients. And that's being done at the medical center and the clinic, and again, really well received. So our pharmacists love working with the patients there. So all in all, we've been really excited about our program, and our patients have been really great at giving us lots of positive feedback as well. So.
Having registered nurses in general in our clinics, I think, provides better access for patients. The clinic I work in, I work with the Partners in Pregnancy Clinic. And other than prenatal care, postpartum care, and baby care, we also offer a service for patients in the community that do not have family physicians. For women, we offer pelvic exams, which also include Pap tests. And myself and the other nurse in the clinic, we have been specially trained and received special certification in order to perform those tests. So it's really important for me that I get to be a part of preventative health care and the education.